Hello, happy Medical Monday, coming at you live from Greenhouse Wellness. As you know, I'm Dr. Leslie Apgar, and with me today is the fabulous Angela Drewniak. We are so happy to have you here. Thank you for joining us.
Thank you for having me.
Angela is a fabulous acute care nurse practitioner specializing in pain management.
Absolutely.
And you're with Maryland Pain and Spine,
Yes, ma'am.
2 locations, Fulton
And Westminster.
And Westminster. Awesome. And can you tell us a little bit about who you are and how you got here?
Oof, well, I've been in medicine for about 20 years now.
Oh my
And
gosh.
yeah, getting old. And it's led me to working with chronic pain patients.
Okay.
And I've been doing that for the past 3.5 years.
Okay. And you're seeing a lot of things. I can
Seeing
only
a lot of
imagine.
changes, absolutely. From insurances not covering some pain medicines to now that we have the access to cannabis. There's a lot of new things coming about for sure.
Okay, so your practice is very open-minded to incorporating cannabis into the treatment program.
Absolutely.
So you don't exclude anybody who would test positive, or do you even test for cannabis? Or?
We do test for cannabis because we actually want to make sure too that our cannabis patients are using cannabis, so that they don't have the issues with the licensure and stuff like that.
Sure.
So we need to make sure that they know that they have to use it within a certain amount of time, or
Right.
they lose it again.
You
So
got it, but it's not an exclusion to them
No,
participating
absolutely
with
not.
you guys as far as your pain
no,
management.
absolutely not. And actually,
Okay.
a lot of people have been seeking us out because we do pain management in combination with medical cannabis.
Yay! Progress. This is
Yes.
amazing.
Yes.
Okay, perfect. So you see patients, new patients, you see
Yes.
existing patients.
Yes.
Are you certifying patients? for-
Absolutely. I'm
Okay.
certifying all kinds of patients, even patients who do not belong to our practice. They can come in just for cannabis as
Okay.
well.
What if somebody wanted help weaning themselves off, say, OxyContin or oxycodone? How would you recommend that they do that? Would that be a patient that you'd be willing to see?
Absolutely, absolutely.
Okay.
Anybody who's on any type of chronic pain medicine, long-acting, short-acting pain medicine, even for post-op patients and the chronic population, we would talk to them about what their goals are with everything as well. And of course, with this whole opioid epidemic, and people are getting really nervous if they're going to be able to have their pain medicines in a year or two. I've even heard some insurance companies are not covering certain ones at this point. So we have to be very open-minded and kind of give them a guide, another tool of how they can manage their pain.
Great.
So we'll take anybody in and help them with that.
Okay, so that's great news. So
Yeah.
anybody who needs help with their pain management, guys, can make an appointment with Angela. And you have a partner?
I have another nurse practitioner
Yeah.
too, Ashley Mazie. She
Mhm.
is also certifying cannabis patients, and
Fabulous.
both of our physicians are gung-ho for it as well.
Good. And you actually are smart in cannabis yourself, right? You
Absolutely.
actually have some personal, you're a
Yep.
patient in Maryland.
I am a patient in
And
there.
that helps, doesn't
It does, absolutely, because then I can give some recommendations to patients of at least initial starting points to try.
Yes.
Yes,
Well,
for my chronic
good.
issues. So.
Well, we are
yeah.
so thrilled that you're here, and we are so thrilled that you are part of this journey with us. And I know our patients are so excited to have options
Absolutely.
for a change.
Absolutely.
So what have you seen as far as the field of pain management? Has it been sort of a tidal wave of change? Has it been slow to change? What have
It's
you
been
done?
slow, and that's kind of how I explain it to people too. It's kind of took you a while to find your pain management regimen. Now give it time to find your regimen with the cannabis as well. Because everybody's so different. I've not seen one single patient say that this particular strain helps them 99% of the time. It's
Got it.
been kind of a different mixture of stuff.
Got
And
it.
that's how I tell them too, because I can use it myself as that way. I've got my kind of one maintenance, and then I've got a different couple breakthroughs during the day if needed, if the pain gets to that point where I need
Great.
to use it like that. So that's kind of what I tell them too. It might take a little bit of time to find certain
We have to
strains that work
experiment a
well.
little bit, which
Absolutely.
is frustrating. Because we
Yes.
would love to be able to say 5 milligrams 6 times a
Absolutely.
day, but it just doesn't work out that way
Exactly.
necessarily.
Exactly.
So our approach, and you and I have talked, so we kind of have the same approach. Obviously, when you're on high doses of opioids, you're going to need higher doses of THC.
Yes.
And we don't start anybody on high doses of THC. We work you up slowly. So be patient and know that
Absolutely.
we can use you guys as a huge resource.
Yes, absolutely.
There are lots of different ways that we can take medicine in, and you know this intimately. It depends on if you vape it, it depends on if you use a topical, it depends on if you ingest. You get different effects.
Yeah.
Well, this is just absolutely fantastic. What have you, or what would you like to see change in the industry, if anything? Do you have anything?
I would love to be able to see patients be able to get medical cannabis a little easier. what that means, I guess that'll depend on how it actually goes in the future, but
Right.
I'd like people to have that more as an available option and quicker for them to utilize it instead of waiting a long time or having to go to certain places to get it. Maybe there'll be more around so that they have more options.
More
I know my
availability.
Carroll County patients have a little harder of a time getting it because there's not as many in Carroll County, whereas here in Ellicott City we've got a plethora of dispensaries.
Yes, we do. Yes, we do. Now, let's just walk everybody through a typical day in your life. What does a typical day in your practice look like? How many patients do you see?
Probably anywhere up to 25 to 30 patients
Oh my
a day.
gosh, Angela. Wow. And how much time are you given, say, with a new pain management patient?
New is usually about a half an hour. The old ones, the regular consults are about 15 minutes. And I probably talk about cannabis more than half with everybody, more
Good.
with the patients with that.
And would you say it's been fairly well received?
It has been. It's funny how I get some of the people who did it in the 70s,
Yeah,
they're laughing
in the
at
60s,
it.
right.
In the 60s and 70s, and they laugh, but then I tell them that it's different than it was back then.
Little-
At least that's what
little
I've heard.
different.
A little different.
A little different.
Yes,
right.
absolutely. So I talk about it quite a bit in my practice. Yeah, a lot of people always have questions, and I'm always there to answer if I can.
Good. How have you been received as far as your other medical professionals, as far as the other practitioners that you might run into? Anybody else in pain management?
I've got a girlfriend who works in hospice, and she was very interested in it too, so her and I have had multiple discussions, so that can help her population. I worked at Hopkins in the past too, and I've spoken to the girls that I worked with there as well, and saying with like liver patients and kidney patients how this could be beneficial for them as well.
So much safer than some of the other medicines.
Safer, absolutely. And there was even an article out there that cannabis is helping the liver regenerate. So it's kind of like when you see the cirrhosis patients or whatnot or end stage, how can this help them too?
Well, that's fantastic. Well, I have to say thank you, because as a medical professional in the cannabis space, it's been awkward and sometimes difficult given the stigma that still surrounds cannabis. So the more of us that are in the industry and the more of us that are promoting the health and the wellness of this plant, the better.
Absolutely.
So I appreciate everything that you're doing. Your patients appreciate you, and we will be sure to send lots of people right to your door. So you're going to be seeing more than 20 or 25 patients a day, my friend.
Absolutely, bring them on.
That's
Bring 'em
great.
on.
That's great. Do you have a special interest before we close up? Do you have a special interest in anything?
My family.
I would like to see my family. But as far as medicine goes, do you like to focus on any one particular aspect?
Oh, with working in pain management, because we want to keep their pains so that they can be functional. So, trying to get people functional is my main goal.
Functional, yeah.
Functionality.
You know what my goal is? Getting patients off their medications.
Yes.
Give it up.
Awesome.
Angela, I'm so proud of you. Thank you so
Thank
much
you
for
for having
joining
me.
us
Thank you.
today. All right, everybody, have a great Monday.
great
We'll
day.
catch you next week. Bye-bye.